All right, welcome back, ladies and gentlemen. So we're now going to shift our conversation and look at the justice and public safety discussion. We are joined by Richard Fyfe, the Deputy Attorney General and Minister of Justice and Attorney General, is in the Ministry of Justice and Attorney General, excuse me for that, and Mark Sieben, who's the Deputy Solicitor General in the Ministry of Public Safety and Solicitor General. Please help me welcome both of them. Excellent. So just as they take their place at the table here, just again as a reminder, they're going to reflect in terms of the the insights they heard from the participating in the regional caucuses throughout the year, and then where they're at in terms of their programming. Gentlemen.
And is somebody moving the
sorry.
PowerPoint? Or?
Can you see that?
Yes, that's perfect. Thank you very much. And as you heard, my name is Richard Fyfe. I'm the Deputy Attorney General, Deputy Minister of Justice, and I'm here with my colleague Mark Sieben, who is the Deputy Solicitor General. I'd like to start by extending my thanks for the invitation and to acknowledge that today we're meeting on the traditional territories of the Coast Salish peoples, in particular the Musqueam, Squamish, and Tsleil-Waututh. The regional caucuses that were held over the last 2 months have provided a unique opportunity both to hear about and to discuss issues that are affecting First Nations individuals and communities in a way that recognizes the interconnections between issues such as justice and health, and opportunities to explore coordinated and collaborative action to address those issues. With some of the issues that have been discussed, the connections are evident. For example, we are all aware of the troubling family violence statistics for Indigenous women. According to Statistics Canada 2014 General Social Survey on Victimization, 10% of Indigenous women were victimized by current or former partners compared to 3% of non-Indigenous women. Nearly 6 in 10 Indigenous female victims of spousal violence indicated they were injured as a result of their victimization compared to 4 in 10 non-Indigenous female victims. And approximately 48% of Indigenous women who experienced violence by a current or former partner reported the most severe forms of violence, such as sexual assault, beating, choking, or threats with a weapon. With other issues, the connections are perhaps less straightforward, but have similarly devastating effects. Negative interactions with the justice system can create the circumstances for profoundly detrimental impacts on health. A criminal record, even for minor offenses, can hinder a person's employability and affect their ability to pay for food or medication, increase the potential of homelessness, and potentially lead to reoffending. Some people can become entangled in a cycle of poverty by seemingly isolated events, such as the inability even to pay fines and fees, resulting in a suspension of a driver's license, the loss of a job, home, or even children. Inmates suffering from mental illness or substance abuse issues are unable to access appropriate services and health interventions to address the very issues that cause them to be incarcerated in the first place. So, interconnected issues will require interconnected responses. I'd like to particularly thank Grand Chief Doug Kelly and the First Nations Health Council membership for your leadership in bringing us together and for the important work that your organization has done to define and engage us on the social determinants of health. It has certainly progressed. So to address the overrepresentation of Indigenous people in the justice system, we need to understand the root causes that have created this tragic situation. Clearly, some of the root causes have been fueled by the negative events in our history, particularly by residential schools, and can manifest later in life through poverty, physical and mental illness, early and prolonged involvement with the justice system, and shorter life expectancy. We're committed to addressing this issue of overrepresentation. And this work will require us to look for opportunities for healing in our actions and decisions so that the changes that we bring about together can benefit future generations and break the cycle of victimization and abuse. And to explore solutions that take into account the physical, mental, emotional, and spiritual elements as intrinsic components of the whole. And to understand the important roles of culture, family, and community in promoting and maintaining wellness. And we just heard Michael talking quite a bit about that, and thank you for that, Michael. We also need to work actively and determinedly on reconciliation. This work is already underway with the leadership of the Ministry of Aboriginal Relations and Reconciliation, but all ministries have their role to play in this effort. I believe that reconciliation is a path we walk together if we want to reach our destination. We must understand areas of conflict and opportunity. Reconciliation requires, as a first step, a candid acknowledgement of how the damaging consequences of our history, racism, and actions aimed at eroding Indigenous cultures and languages have contributed to the current situations of Indigenous peoples in BC. To achieve reconciliation, we must confront this legacy and move past it. We must all commit ourselves to the meaningful action that is necessary for us as a society to move forward. To change the statistics regarding the overrepresentation of Indigenous people in the justice system, we must apply more culturally relevant and community-based initiatives and explore the use of traditional models that reinforce strong cultural ties, which we know can build resilience and are protective factors against crime and poor health outcomes. Oops. There's an abundant, strong evidence for the connections among issues of mental health, substance misuse, and contact with the justice system. This has been referred to as the criminalization of mental illness. Surveys indicate that approximately 75% of all residents in First Nations and Inuit communities consider that alcohol use is a problem in their community. According to a 2008 to 2010 survey by the First Nations Information Governance Center, almost 25% of First Nations adults reported contemplating suicide at some point in their lives, compared to the 9% of adults from the general Canadian population who reported having similar thoughts. From 1996 to 2009, the percentage of Indigenous inmates with serious mental illness fluctuated between 5% and 14%. And their overrepresentation in the correctional system as a whole, as well as significant overrepresentation in self-injurious incidents, suggests that there are serious mental health needs in this population. Indigenous people make up approximately 4% of the Canadian population, but 21% of the federal prison population. The justice and public safety sector recognizes the importance of working in a coordinated way to address links among mental health, addictions, and justice. The regional caucuses this fall helped launch a deeper dialogue between ministries and Indigenous organizations on both underlying contributing factors and potential opportunities for collaboration. The 2016 Justice Summits in June and November also focused on the issue of mental health, substance misuse, and the justice system. And the report on the November Justice Summit proceedings is being prepared now in order to be released in early 2017. We hope to engage you at the First Nations Health Council on the recommendations to get better understanding of how to address this issue more effectively. Just talking for a minute about the impact of FASD on families and communities. The prevalence of FASD in Indigenous communities is in serious need of action. Research suggests that the higher rates of FASD in Indigenous populations are correlated to intergenerational trauma, particularly due to residential schools. Adolescents and adults with FASD exhibit memory impairment, problems with judgment and abstract reasoning, and poor adaptive functioning. These difficulties often show up as victimization, lack of focus, inability to understand consequences, frustration, impulsiveness, poor academic achievement, antisocial behavior, inappropriate sexual behaviors, substance misuse, mental health problems, and a high incidence of negative interaction with the justice system. In addition, according to a 2015 report by the Center for Addiction and Mental Health, the prevalence of FASD among children and youth in care is disproportionately higher than among the general population. With an estimated 80% of youth in the youth justice system being formerly children in care, the implications are clear. We need to find a better approach to children in care.
And now it's my turn. Thank you very much, Richard, and good afternoon, everyone. I'm very pleased to be able to be here today and very appreciative of being granted the opportunity to sit and spend a little bit of time with you this afternoon. I'll be following up a little bit further from Richard's comments regarding what was heard during the regional caucuses and reflecting the commitment that we're looking to make both personally and on behalf of our ministries in pursuing the work forward. So during the regional health caucus sessions, we heard of the importance of listening and of your understandable interest in shared decision making. And we are committed to ongoing consultations with those lessons in mind. Some examples of where and how this dialogue will continue include sort of not only sessions such as this and future gathering wisdoms and future regional caucuses, but importantly also the greater involvement of staff in our ministries to participate in those sessions, given they're the ones that are doing the work in your communities and the ones that will benefit as well from listening and engagement with leaders at a local level. We will also be having continued engagement with the Ministers' Advisory Council on Aboriginal Women and the BC Aboriginal Justice Council, a group that Richard and I met with on a rather rainy Saturday about a month or so ago. Importantly, too, we will also be looking to motivate and encourage our staff, give direction to our staff to engage at a local level with local leaders through the regional health councils and other entities. But we'll also be looking to create a space to discuss issues relating to justice and public safety for Indigenous peoples. The justice summits that Richard noted a moment ago encourage innovation and facilitate coordination and collaboration across our sector. These summits are a forum for open discussion among leaders about how the system is performing, about how it isn't performing, and how to seek improvement. We have benefited greatly from having significant First Nation participation in previous summits. There's been 5 or 6 of them to date. Most of them have covered different aspects of justice and experience in the justice system. The last 2, as Richard noted, pertained to mental health and the justice system, and we were very, very grateful to have Grand Chief Doug Kelly and members from the Aboriginal Justice Council in attendance for those sessions. We will be working with the Justice and Public Safety Council, which sponsors these summits, as well as First Nations leadership on a potential 2017 Justice Summit, which will focus on ways to improve justice outcomes for Indigenous peoples. That event, should it occur, and we'll be pushing for it strongly, is likely to happen towards the middle or the back end of 2017. While continued dialogue and consultation is, of course, fundamentally important, we also need to move forward with key actions to implement approaches that we have already seen have shown positive outcomes. So, for example, Richard's ministry is gaining experience with First Nations courts. We know that Aboriginal people are overrepresented in the justice system, and First Nation courts take a different, appropriate approach to find solutions to the issues underlying criminal behavior. First Nation courts provide support and healing to assist in offender rehabilitation and seek to acknowledge and repair the harm done to victims and communities. Local First Nation communities are encouraged to contribute to the proceedings, and elders often attend court to represent the community. There are 4 First Nation courts in BC at present: Duncan, New Westminster, North Vancouver, and Kamloops, and they currently address criminal matters. Government will be conducting an analysis of First Nation court models to improve Aboriginal people's outcomes in the justice system, with a view to exploring options for additional First Nation courts in consultation and in collaboration with the Office of the Chief Judge of the Provincial Court, His Honour Justice Thomas Crabtree. Other items of interest and importance that arose during the regional caucus sessions included a very strong and recurrent reminder that service availability is not the same throughout the province, and that often it is the rural and remote and Indigenous communities that have less access to services than in comparison to urban communities, and that is something that we acknowledge that needs to be addressed. We also heard a lot of interest in what we refer to as restorative justice, opportunities to involve community processes and shared decision-making in dealing with matters before they get to a court, in order to respond as best and as appropriately as possible to the needs of the victim, to the context of the community, and to respond also to the offender's role in a way that reflects the balances, the interests of the community, and the opportunity for rehabilitation, and hopefully the opportunity to avoid the formal court system wherever possible. Restorative justice might also be used in conjunction with the reintegration of a person who has been away in a correctional facility and is now looking to return home to a community. It was also reflected in those caucus sessions of the need on government side to ensure staff have a greater and increased appreciation of the people and the communities and the context in which they are working. So to that end, in partnership with the Provincial Health Service Authority, the Sanya's Indigenous Cultural Safety Training Course is being adapted for justice and public safety staff across our whole sector. Now, this is an online course, and that's terrific. At the same time, though, we recognize that that doesn't replace the need to increase interaction for staff with First Nations within their areas and communities directly, given, of course, that each First Nation is different. We look forward to continued dialogue on these issues, including strengthening relationships between First Nation communities and BC Corrections, which is in my ministry, at local and at provincial levels. And for me, that means both through the correctional centers in the province, as well as through our community correctional officers, like probation officers. Another theme that arose in the sessions is for our ministries to do whatever we can to support the work being done in MCFD to improve the outcomes for Indigenous children in care, families, and those communities, and that is something that we'll be looking at doing as well. Another item of importance that has arisen not just in the regional caucuses, but in other meetings that government has had and that I've been participating in over the course of this fall relates to policing and how there is a strong desire to discuss and talk about what policing looks like in communities. We will be encouraging RCMP and local police forces in the province to engage directly with First Nation leadership, again, at all levels, in order to discuss policing and safety priorities in communities. And I also want to touch quickly on First Nations policing specifically. The First Nation policing program was established by the federal government in 1991 and provides policing services to approximately 130 BC First Nation communities. These agreements expire on March 31st, 2018. And leading up to the renewal of the agreements, the federal government, through Public Safety Canada, is undertaking a review of these programs. The province has provided feedback to Canada indicating that funding, which is cost-shared between the federal government and the provincial government, needs to be increased to sustain the current commitment and, in fact, deliver on the promise that has been made to date, particularly in the areas of training and equipment, and also expand the program to other communities that are interested. I would urge you, if you are interested in this area and have not yet had an opportunity to do so, to provide input to the federal government through Public Safety Canada on this topic. We should also touch on the National Inquiry on Missing and Murdered Indigenous Women and Girls. BC has signed on to the inquiry, as have all other provinces. The National Inquiry's mandate is to examine and report on systemic causes of violence experienced by Indigenous women and girls and their greater vulnerability to violence. This includes looking into the underlying historical, social, economic, institutional, and cultural factors that contribute to the violence, as well as institutional policies and practices that have been implemented in response to that violence. Along with you, we await word from the inquiry regarding how and when it will conduct its business. And the work that BC does in this area will be built on the work that will continue to proceed in response to the Opal inquiry. That work isn't intended to sort of wait as the National Inquiry gets up and running, but we will continue to pursue that work. And then a final initiative that I'll note quickly for you in this area is the development of a multi-year trauma-informed training and practice initiative to more effectively respond to the impacts of violence or trauma on the part of victims, the accused, and communities. And this is an initiative that grew from one of our previous Justice Summits and touches each part of our justice system. The upcoming Justice and Public Safety Service Plan will include strategies to reflect the concerns raised at the regional caucuses and to support improved outcomes for Aboriginal people across the justice system. We want to continue this conversation with leadership at all levels, provincially and locally, in order to pursue better outcomes. And this will include continual engagement through the First Nations Health Council, through the Minister's Advisory Council on Aboriginal Women, and the Aboriginal Justice Council, which has a mandate to work with us in this area, and we're looking to pursue an agreement about how best to undertake this, much of this work. In addition, we recognize that local community and nation perspectives are required to identify unique needs and concerns, and you will see this reflected in our next service plan. And finally, we look forward to working with you on the 10-year strategy for social determinants. Thank you.
So thank you very much to Deputy Attorney General Fyfe and Deputy Solicitor General Sieben. I believe there's 2 members of the First Nations Health Council coming forward to provide a token of appreciation for taking the time to share with us on some of the directions and where you're looking for further input.